Is Sarah Harris on? Yes. Yeah. So we've got the next presentation is essentially about women's experiences of endometriosis interventions and information and their perceived effectiveness. Now, this is a qualitative study that Sarah Harris is going to present. She is doing her master's in public health at the University of Nottingham. And this is part of her thesis that she is going to present. And we are much obliged for her, much obliged that she is doing this presentation on our platform, and that's really, really brilliant. Sarah, oh, hang on, it is the video, isn't it? So yes. Sarah is, I think, having some technical issues with her presentation with her computer. So we're going to be playing a video, but she will be coming on to answer any questions should anybody have them. Thank you. I think you need to do the same thing.
Good afternoon. My name is Sarah Harris, and I'm a Master's of
Just
Public Health
pause it.
student at the University of Nottingham.
Can everybody see the screen, the full screen? Prof, can we see the full screen?
Yeah, I can see it here.
Yes. You can. All right. Okay. Okay, go on.
As part of my MPH thesis, I completed a research project titled Women's Experiences of Endometriosis Interventions and Information and Their Perceived Effectiveness, a Qualitative Study. The project was supervised by Dr. Leila Tata and is currently being prepared for publication with the help of Dr. Tata and Professor Amir. The aims of the study were to explore women's attitudes towards existing endometriosis interventions and information, and explore whether the participants found them effective in managing their condition overall. The objectives were to understand participant experiences with these interventions and information sources, and to assess which was the most effective and identify any potential gaps in information sources, as well as issues in existing interventions. A qualitative study was deemed as the most appropriate design to understand the perspectives of participants, as this would allow for in-depth responses and descriptions. A constructionist approach was selected as the research paradigm, which allowed for the consideration of the impact of reality and wider sociocultural factors. Eligibility criteria included those with a confirmed endometriosis diagnosis who were over the age of 18 and living in the UK. To recruit participants, a poster was shared with 3 endometriosis support groups on Facebook. Those who were interested were asked to get in touch, and an information guide stating the purpose of the study and what the data collection method would entail was shared with them. 24 participants were recruited and semi-structured interviews with them were conducted. The interviews were then transcribed and analysed using Braun and Clark's thematic analysis model. 5 main themes were identified, which I will discuss now. The first theme, which was identified, covered the experiences of the diagnosis process and the impact of endometriosis symptoms on the participants' overall quality of life. Several participants reported negative experiences with the diagnosis process due to the length of time it took for them to get a diagnosis since they first presented with symptoms. One participant reported that it took 18 years to get a diagnosis since she first spoke to a healthcare professional about symptoms. Participants were also commonly misdiagnosed with irritable bowel syndrome and believed that this contributed toward their delayed diagnosis. 23 out of the 24 participants felt that their symptoms had been dismissed by a healthcare professional either before or after their diagnosis. Several participants believed that this was due to the misconception that periods are meant to be painful. Every participant believed that endometriosis had some form of negative aspect on their quality of life. Participants whose symptoms first presented at a young age or whilst they were in some form of education found it had a huge impact on their academic life, and several participants reported losing their jobs or having to switch career due to their endometriosis. Several participants reported that the condition had an impact on their relationships and put a strain on them. The second theme explored participant experiences with the interventions that had been recommended by the NICE guidelines for endometriosis. At the moment, the NICE guidelines recommend pharmacological management in the form of analgesics, neuromodulators, and hormonal therapies, as well as surgical management. Of the 24 participants, all of them had accessed some form of hormonal therapy. 54% of them had taken some form of prescription painkiller, and 71% of them had one or more surgery. The experiences of these interventions varied. Several participants found that hormonal therapies were useful in stopping their menstrual cycle or reducing the pain. However, the side effects such as low mood, migraines, and weight gain often outweighed these benefits and would take months before any sort of difference was made. None of the participants found hormonal therapies alone to be completely effective in managing their endometriosis symptoms. This was also reported in those who tried prescription painkillers, with many participants saying it reduced but did not completely alleviate the pain. Amongst the 17 participants who had surgery, the majority found surgery to be beneficial for a few months or up to 3 years, but stated that their symptoms would then return. One participant had undergone a total hysterectomy and expressed that this was completely effective in treating their endometriosis symptoms. Almost all participants reported difficulty in accessing these interventions due to the long waiting lists and referral periods. Many believe these issues had been exacerbated by the pandemic. A few of the participants reported having to access private healthcare treatment as a result of the wait. The third theme explored interventions and techniques used by the participants that haven't been recommended by the NICE guidelines and whether these were beneficial. Over half of the participants stated that they had tried some form of alternative therapy or herbal remedies, such as CBD products, Chinese herbal supplements and teas, and acupuncture. All of the participants who had tried these methods said that they had gained knowledge of these methods through their own research or through word of mouth from other endometriosis sufferers. When asked if healthcare professionals had suggested any alternative therapies, all participants shared that they had not. Some participants stated that they were reluctant to even mention these methods to their physicians due to fear of judgment. Almost every participant had tried to make dietary changes at some point, and again did so after their own research. Many participants found that dietary changes to be useful to some extent, and in particular, reducing gluten and dairy were found to be effective for several participants. Lifestyle changes such as regular exercise, meditation, and quitting smoking were also found to be useful by a number of participants. The fourth theme explored the various information sources that were accessed and utilized by participants and whether they found them effective in aiding their understanding of endometriosis. Participants commonly reported that they received little to no information from their healthcare professionals during the diagnosis process and had to actively seek out information on their own. Several participants stated that their GPs had admitted to not having adequate knowledge on the disease, with one participant sharing that their GP had said that they had never heard of the disease at all. Many of the participants believed that had their GP equipped them with information on endometriosis earlier on, they would have been more likely to advocate for a diagnosis or referral. Every single participant had access to information online at some point. The primary sources of information that participants used were the NHS website or the Endometriosis UK website. However, they found that both these websites only provided them with limited information, and in particular believed that Endometriosis UK needed more in-depth information on their website. Many participants found that the following social media accounts on endometriosis specialists and surgeons were useful sources of information. However, several participants were wary of the information that they accessed online and were aware of the risk of accessing unreliable information. However, they had grown accustomed to filtering out information they did not believe to be beneficial. Most of the participants were members of online support groups and also found them to be useful sources of information, as this was often backed up by personal experiences. They also found the community aspect of these groups made it easier to seek out information from other members, as opposed to asking healthcare professionals. The final theme explored the recommendations made by participants. Several participants believed that implementing endometriosis into educational curriculums would have been beneficial to them during the diagnosis process by making them aware that their symptoms were abnormal. They also believed that this would have been helpful for family and friends to understand what they were going through and recommended the need for information sources for these relations. Several participants suggested that seeking out information would be easier if they could access all the information from one source rather than multiple sources. All participants believed that there was a need for further awareness around endometriosis. Other suggestions included access to alternative therapies that have been recommended by healthcare professionals themselves. Overall, it was clear that not one particular intervention was completely effective, but many were partially effective. Despite this, the side effects of many of the interventions often outweighed the benefits and added further problems. It could be recommended that a more holistic approach is needed when suggesting interventions that assesses the patient's overall needs and circumstances. In terms of information, whilst the internet is a common source of information, it comes with its risk and is not always completely effective. An information source from a reputable resource, such as an endometriosis charity or health organization that provides more in-depth information, would be useful to those going through the diagnosis process, but also those who have already received a diagnosis. There is clearly a need for further research in both the effectiveness of endometriosis interventions and information and overall experiences of endometriosis. Thank you so much for listening to my talk. These are the references I used.
Thank you.
Thank you, Sarah.
Thanks, Sarah. Excellent talk. Are you still with us?
No, I
No.
Yeah, oh, yeah, there we
She's
are.
there, yeah.
Sorry, I'm having some technical difficulties, but I am here.
Any questions from anyone? I think.
So how far is your writing up?
I will drop you an email about that, but it will be done soon.
Okay.
It's a really
I think,
good,
thank you very much. That was fantastic talk. I think they've all tired after a long day. I think it's probably just time to wrap everything up now, but thank you very much, Sarah. Can we just wrap the day up by saying thank you to all the faculty members for a fantastic day. Subal, Saad, Nilifor, Jane, thank you for a great day. Can I thank all the delegates for participating and getting involved and asking appropriate questions. The only thing I'd ask is anybody who has signed in without their full name, can you just put your email address and full name in the chat box so that Jane can actually know who it is and send you appropriate certificates, either or register online saying that you'd attended with whatever name you've attended as. Jane will fill out the feedback form, send you a feedback form, sorry, once we've got the participation list through. And the only thing that's left for me to say is that we've penciled in a date of the 17th of May next year for the third Delta's Gynae Endometriosis Symposium. And obviously log into that and sign up to that and let all your colleagues know. Anything to add? Nilifor, Saad, could all of you put your cameras on as before you're leaving so we know who's still there, so that we can say goodbye to people as they log off? And somebody's very relaxed there. Taiwo.